So the Worcestershire acute hospitals are primarily 3 acute hospital sites. We are sited in Worcester, Kidderminster and Redditch. We started to look at what were people putting in place in organisations to provide transparency from the point at which you think I need a locum or an agency doctor or a bank doctor to the point at which you pay that invoice. The HCL system was one that we started to see had got the potential to give us an opportunity to learn more about the way that we manage that temporary workforce. HCL is more advanced in its understanding of what that system, of how functional that system needs to be for trusts. The implementation process for the HCL Clarity system was a really great example of project planning, where the majority of the in fact, all of the hard work is done by HCL staff themselves. They've just been really professional about getting the system up and running quickly. The HCL system, certainly in terms of efficiency and value for money, it's given us, that opportunity to better manage a system where we'd got what we could have described it as a fairly uncontrollable spend.
The HCL Clarity system has standardised the process across the board and is very easy to use. It takes seconds to put a shift out and you get constant email updates, so it does a lot of the work for you.
One of the great benefits of this system is that we've been able to develop an in-house bank of doctors using the system in a way that we couldn't before, because we didn't keep a track of all of those junior doctors who previously worked with us.
We've increased the number of internal bank locums up to 627.
We've got that sort of transparency around the frequency at which we've been filling some of these gaps to know that we need to go elsewhere to start to look at permanent doctors where they're available.
The intelligence gathered from the system has supported internal business cases to permanently recruit individuals.
Well, the efficiencies are around renegotiating rates, which I think are really critical, and ensuring that all of your agencies stick to those framework rates.
We've managed to negotiate with suppliers on their margins a reduction of approximately 12% per year.
The other efficiencies are around pre-employment, so we don't use the occupational health service in the way we did locally before.
It's also not to be underestimated the expertise that HCL Clarity brought, having had experience within the recruitment industry itself. Some of that intelligence led to a significant improvement in supplier relationship management, which led to the success of the project. So how much has this saved the Trust in terms of numbers? Indicatively, £1.3 million.
HCL Clarity impacts on patient care because we can put out continuity shifts so that we can always book the same doctor for a run of shifts. It also shows you if the doctor has worked there and in your department before, so they know the hospital, and if it's within a close date, they'll also know your patients.
The quality of the agency worker that came to us, if you're getting from 56 suppliers as opposed to 16, you've got a little bit more, you can put a little bit more scrutiny into performance managing those agencies, which is what we've done, which I think created much better relationships with those suppliers because they're supplying more frequently to us, but actually they're also understanding what our standards are around the people that we want to employ. The fact that we've been able to improve our fill rate with agencies where we know we've got an agreed standard of compliance, and that's got to have a benefit for patient care.